Welcome to the short presentation on Educational Design Process Overview, Continuing Nursing Education. The very first step in applying for any continuing nursing education is completing a needs assessment. All education must begin with a needs assessment. The needs assessment is your evidence to say why the education you're providing is necessary. Remember, in continuing nursing education, it is important that we are addressing a gap in some type of knowledge, skill, or practice. The needs assessment data tells us that gap exists. It is not okay just to provide education because you believe it's needed or because someone simply asks you to do so. What is important is that you show there's a need for what you're doing. Needs assessment data can include employee survey data, literature review, outcome data, survey results from stakeholders, quality data, requests via phone, email, or in person. Remember, those requests should be either multiple requests or detailed requests on why something's needed, not just, hey, can you do this? And written evaluation summary requests. Once you have the needs data, you can then look and determine what is your gap. You either have a gap in knowledge, skill, or practice. If the gap is due to knowledge, it means people don't know the information. If the gap is due to skill, it means people do not know how to use the skill or perform the skill. If the gap is due to practice, people might know it and they might know how to do it, but they're not able to show it or do it in practice. You might find that your needs assessment data shows a gap in knowledge, skill, and practice. However, in your particular educational program, you might only be addressing knowledge or only addressing skill. That's okay. But it's really important to understand what is the gap that your needs assessment data shows you. When you start to then plan your education, you have to go back to what is that need. Is it a knowledge, is it a skill, or is it a practice gap? And then start thinking about the outcome. Your outcome should be directly related to the gap. Let's look a little more at outcomes. The outcome is the result of your activity or program. There are many different kinds of educational outcomes. If you look at the figure to the right, you can see at the very bottom of the triangle is participation. That's followed by satisfaction. These are very low-level outcomes. You're only measuring, did the person come? Are they satisfied with the activity? When you move above that, you start to really look at learning. Did people learn? Then competence, performance, and at the very, very top, patient health and potentially community health. I challenge you as you think about your outcomes to not just stop with participation and satisfaction, but really look at how can you make sure people are learning, that they're competent, and that they can perform with the information that you've given them. This is a gap analysis worksheet. These worksheets are available through PSNA if you find it helpful. These worksheets can help you make sure that from your needs assessment, through your gap, through your outcome, you're following the same thread. It's not uncommon to see applications where the needs assessment and the gap match, but nothing else in the program matches the gap and the state. The desired state and current state simply describe your needs assessment. What do you see as the desired state based on your needs assessment? What is the current state? With that, you can identify what the gap is, if it's due to knowledge, skill, or practice, what the outcome is you want to see, and how you're going to measure that. The outcome measure essentially also becomes your evaluation. Here's an example. The desired state might be that pediatric patients in respiratory distress are put on a non-rebreather face mask within 5 minutes of coming to the emergency department 100% of the time. That's what we want to see happen. What's currently happening? Well, pediatric patients are placed on a non-rebreather within 5 minutes 100% of the time, but the mask is not applied appropriately. So what we're seeing is the skill is not being done correctly. So when we look at the identified gap, it's a skill. It's not that they don't know how to use the rebreather in terms of what patients to put it on. It's that when they're putting it on the patients, it's not being applied appropriately. So our gap then is a lack of skill in applying the mask for pediatric patients. Our outcome would be registered nurses in the emergency department will be able to apply a non-rebreather face mask correctly to all pediatric patients in distress. And then our outcome measure is the successful return demonstration of application of that mask for pediatric patients. They're also going to be looking at correctly assessing signs and symptoms. So you can see that the desired state and current state tell us what our gap is. Now we would also have needs assessment data to tell us that this is not happening 100% of the time. Please note that the desired, current state, and identified gap all look at skill. The outcome and the outcome measure also look at skill. Many times in applications, the current desired state and the identified gap might look at one thing such as skill, but the outcome measure might just be knowledge. That's where an educational program is not strong and consistent. So that's where this type of worksheet can be helpful. Once you've determined what your outcome is going to be, for example, in the example we just looked at, you then have to look at your evaluation. If you're looking at a gap in knowledge, some way in your evaluation you should be assessing knowledge. If it's a knowledge test, multiple choice, similar, if it's some sort of open-ended discussion. If you've determined that your gap has a skill component, you should be looking at assessing skill, case studies, case presentations, essay questions, skill demonstration. And if you're looking at practice, you should have some way to know, are folks going to practice? This could be simulation, you might actually observe people in a practice setting, or you might ask them about their intent to change their practice. This is how you make sure that your education design process is solid from beginning to end. If you have any questions about this, please don't hesitate to call or ask us at PSNA.